Hey, Dr. Wong. Oh, it looks like you're on mute. Yeah, you're on mute. All right. All right.
Mona.
Of course, I have Mona. Mona will be here. She comes in almost every day now.
Oh, wonderful. She really wants to improve.
She's doing everything. She's doing everything.
Good.
All right. Hi, everybody. I'm Brian, and we'll get started very, very soon. Hey, Peggy. All right. Irene, Norman, Beth. All right. Let's see. Oh, I gotta start. Gotta start on Facebook Live. Hold on. Turn that on. All right. All right, we're going to be streaming on Facebook as well. There we go. There we go. Go live. All right. How's your day, Dr. Wong?
That's an excellent day I had.
Excellent day.
Good.
Very good. All right. All right, everybody. Thank you for joining. This is a good turnout today. So we have the privilege. So I'm Brian. I'm the owner here at OsteoStrong in Torrance. And this is a new live event that we're doing periodically. So far, we're scheduling them almost weekly at this point. And the idea is to bring in health experts in the local area so that we can always learn. In the health industry, there's always lots of things that we could always be learning. And someone like Dr. Wong, I have the privilege of meeting him a few weeks ago, and vast amounts of knowledge and very much in alignment to the philosophy that we have here is everything is natural. So we want to work with practitioners like Dr. Wong on any kind of health benefits and things that we can be doing for better health, longevity, building our immune system, and in this case, stronger bones, less pain, things like that. So Dr. Wong is literally just down the road from us, been practicing for over, 40 years?
40-some years, yeah.
40-something years. And the other amazing thing is, besides 40-something years, he's traveled to over, get this,
75 countries.
75 countries. I can't even name 75 countries. I think I've been to 25 countries. I'm not even halfway, but he's been to 75. So I'm sure he's got lots of stories, amazing people he's met along the way, and go from there. But tonight, Dr. Wong will be talking about your hormones and your bones. And he'll do a presentation there. And then also we'll have time for questions from the audience on the call itself. So Dr. Wong, you want to take it away? And then you can share.
Sure. Yeah. Thanks again, Brian, for inviting me. And I think this is a wonderful way of sharing information and knowledge. And I'm more than happy to share, all the years of experience I've had. So let me see, I'm going to start by sharing my slides here. Okay, share. Okay, can everybody see the slides?
Yep, if you want to put it in.
Okay, so this is the talk, of course, the hormones and bone health. Okay. I'd like to start with a word of wisdom.
Do you want to put it in presentation mode so we can see the full screen?
How do I get it going? Oh, here we go. Okay. I'd like to just share words of wisdom. This is from one of our favorite health participants, John Dalen. I've known him for so many years. And he always says, we age because our hormones decline. Our hormones don't decline because we age. Live a long time, but don't age. Isn't that a great philosophy? Unfortunately, John passed away about age 90 a few years ago, and we really miss him. He was a great person. He was actually a coach, gymnastic coach in San Pedro, and he was a bodybuilder for many, many years. Now, I think all of us know the difference between biological age and chronological age, right? Chronological age is when we were born, whereas biological age really sees how young our body is. Actually, the last talk, I think Dr. Nicole Marciano did was excellent. She talked about how to keep young. And I love the message that she said. She doesn't like the term anti-aging. I feel the same. We can't go against aging. We can age gracefully and we can slow down the aging process. Some of these things are what we call biomarkers of vitality. I think we know that when we age, some of these things decrease. Vitality, of course, talks about muscle strength, our metabolic rate, the body fat, aerobic capacity, the lipids, blood pressure, lung capacity. And of course, today we're going to emphasize on the bone density. And of course, skin elasticity, balance. And I'm glad that Brian, besides working with the bones, they emphasize a lot about balance. Reaction time. We'll talk quite a bit about hormones also. Now, we all have heard the term menopause. We also know that men go through the decline of hormones. Women, it's kind of pretty specific. You go through menopause when your periods kind of stop. In fact, we call that after your period stop for a whole year, then you are into menopause. Prior to that, of course, you are in perimenopause. And we'll kind of talk a little bit about some of the symptoms of perimenopause. Now, in women, as we can see here, with menopause, your estrogen decreases, but also your adrenal hormones, DHEA, and also progesterone. And most women notice that when they're in menopause, they increase the body fat. They also have a lot more mood swings and problems. Sexual function decreases, the loss of libido, decreased sexual desire. Heart disease also increase, and of course, osteoporosis. That's a big one, and that's why hormones can help in terms of slowing down the bone loss. In men, you can see here the decrease in testosterone will also increase the body fat. That's why a lot of men so-called, they get the fat, in the breast, other parts of the body. They also go through mood swings. They're more depressed, loss of enjoyment in life, decreased sexual function, less libido, increase in heart diseases, and also men have problems with osteoporosis. Perhaps less than women, but there is also present an increase of prostate. I think many people can identify with this, right? When it's really cold out, but yet the women, they are fanning themselves, they're having hot flashes. Okay, that's one of the big signs, of course, with menopause, the symptoms. I just want to touch a little bit about the bone strength. Of course, we talk about osteoporosis, improving the bone strength, the bone density, and that's where the exercises that you can do at Brian's place can increase your bone density. The other part that we forget is the bone qualities, the architecture of the bones, the turnover of the bones, the damage, mineralization, the metric, all that in conjunction with hormones. Now I want to show you a chart. You can't probably see it, but this is the chart about hormones. Look at all the connection between the hormones, from the top to the bottom. And the chart I'm showing you is really a very simplified diagram of hormones. We have to have cholesterol, manufactured hormones. That's why people that have very low cholesterol have difficulties with hormone manufacturing. The breakdown of cholesterol will be to pregnenolone, which is the main hormone. We'll talk more about individual hormones. Pregnenolone, of course, helps with your memory, your concentration. That's why when women go through menopause, they get very forgetful, their concentration is decreased. Of course, pregnenolone breaks down the progesterone, which is a very important hormone for bone density and moods. And of course, the other important part is the DHEA, which is the adrenal hormones. We'll touch upon individually how the hormones make a difference. DHEA, of course, then breaks down into testosterone. Testosterone, as we know, is mainly a male hormone. But women also have testosterone. In fact, testosterone helps your bones to have good bone density. And then we'll talk more about the estrogen. You may or may not know that there are actually 3 forms of estrogen. There's the estrone, which is E1, which is the strongest of the estrogen. And then you have the estradiol, which is the E2. And then you have E3, which is the majority of the estrogen in your body, which is E3. Some of the hormones is what we call can be replaced as we age because they decrease in your body system. We touched upon the human growth hormone, testosterone. As I mentioned, the estrogen, we have E1, E2, E3, and then the progesterone. Now, many of us forget that thyroid is also a hormone. And actually, thyroid can affect the bone density. People that have overactive thyroid can actually, metabolize the bone much faster, and they're more prone to the osteoporosis, osteopenia. DHEA is very important because it's an adrenal hormone. Actually, sometimes people call it the mother of all hormones because it breaks down into the other hormones. As I mentioned here, pregnenolone is a brain hormone, helps with our concentration and moods. If we have time, I'd like to touch upon melatonin. Then, of course, the thymus, which is very important for the immune system. In fact, with all the pandemic going on now, we want to be sure that we maintain good thymus function. Okay, what are some of the symptoms that people have relating to hormones? This is particularly with the estrogen hormones. As you can see here, women with the estrogen can affect their premenstrual periods, the fertility, and of course, when your estrogen goes down, you will have irregular menstrual cycles. In fact, when you think about it, the first hormone to decrease is the adrenal hormone. And then the next one is the progesterone. When your progesterone decreases, then you get into very irregular menstrual cycles. It could be very heavy menstrual cycles and or very light, irregular menstrual cycles. Of course, the breast also changes, more fibrous disease, mood swings, as we mentioned, decreased libido, weight gains, very common. Of course, the vaginal dryness, thinning. And that's why women, when they go through menopause, they have a lot more urinary infections because of the irritation. Dysmenorrhea, we call the input sexual intercourse, hot flashes, night sweats, depression, and so on. Of course, the big one is the osteoporosis. I will maybe come back to some of these things here later on. Now, how do we, first of all, how can we determine what a person may be lacking in hormones? In the past, doctors usually prescribe the same hormones to everyone. Unfortunately, not one size fits all. I think that's why hormone replacement therapy has not been very successful because doctors don't tend to individualize it for the person. There's several ways that we can determine bodies may be lacking. We can measure it through the urine because that's the metabolic breakdown of the hormones. This is actually a good measurement, but women don't usually like this to do the urine measurement because they have to collect it for 24 hours. And it gets to be a little bit bothersome, to collect the urine, every urine that you have for a whole 24 hours. We can also do the hormones through the blood draw. It's also important to know the time of the cycle. If you're having a cycle, to get an accurate measurement. For women that are still having menstrual cycles, we want to get the testing about 7 to 10 days before the cycle. Of course, saliva is another way of testing the hormones. In women that are menopause, it's not as helpful. The level is very low. So sometimes the saliva would not be helpful to determine the amount of hormones in the body system. The other part, of course, is by symptoms. Let me see here. And these are some of the questions that we would ask a person. Okay. For example, the progesterone, they usually will have problems with concentration, problems sleeping. In fact, a lot of women that have trouble sleeping, when we add extra progesterone to the hormones, especially with cream, you find that they can sleep through the night and they're very sound sleep. Okay. As you can see here, moods, going through depression, anxiety is very common also, decreasing the progesterone, headaches, okay, moodiness, as we mentioned, and of course the breast problems. Most of women we find in the US are estrogen dominant, which means that they produce a lot more estrogen than progesterone and the other hormones. Okay? If you're overweight and have a lot of fat in your system, you're more prone to produce a lot more estrogen than progesterone. Progesterone also helps, of course, to maintain the weight. You can see here, progesterone is very helpful for women that are going through PMS. We generally will have them use extra progesterone for about a week to 10 days before the cycles to help them to decrease the symptoms of the PMS. And you can see here the lacking of estrogen. Main symptoms, again, are the hot flashes, okay? Difficulties remembering things. In fact, a friend of mine has written a book called 40 and Forgetful. Because women at about that age, in the late 40s, they will go through problems, challenges with the memory. We had mentioned the hot flashes, the vaginal dryness, a big change in the skin, loss of elasticity and collagen. In fact, you can tell a woman that that's very using any hormone replacement, they will really have very poor skin tone, sagginess, and just not good skin. Incontinence, we mentioned, because of the vaginal dryness and so on, frequent vaginal infection. So also, you can see here, ability to reach orgasm that can be related to estrogen, and also painful sexual intercourse. Now, with testosterone, usually we will ask questions, how's your libido, how's your sex drive? If it is low, we can improve that through the use of hormones. And we'll talk about hormone will help the most, okay? Like you say, lack of desire to be intimate, loss of motivation, the moods, and also not feeling well. And of course, the bone density is a big one also in terms of the decrease in the hormones. Okay. I'd like to touch a little bit about the adrenals. I think we know about the adrenals because, when you're under stress, you have a lot of adrenaline, right? The fight or flight kind of reaction, yeah. In Chinese medicine, they've talked for many thousands of years about yin and yang. Western medicine is finally understanding what they're talking about is the imbalance of autonomic nervous system. We've got two components. One is the sympathetic, which is the fight or flight, right? Where you're under stress. You're able to, let's say, like you've heard of people, there's an accident and the loved one is trapped under the car. They have enough strength to actually lift the car because that's a lot of the adrenaline flow. The other part, of course, is the parasympathetic. And this is, of course, how you build up your body system. Okay? You need to be in balance because too much of the parasympathetic, you feel like very low mood, like not much energy. Too much of the sympathetic, you'll be under a lot of stress, you'll be very anxious and so on. So the balance is really the key. In fact, we have a whole program that we can help people develop the balance between the autonomic system, the yin and the yang. Of course, one of the best way to do that is also through acupuncture. So acupuncture really helps to balance out the yin and the yang, and the use of herbs and also supplements. You can see here when your adrenals is exhausted due to the aging process and then also due to stress. These are some of the things that will happen to you. Increased ability to handle the stress. You can see a hard time waking up in the morning because your adrenal or the cortisol level is high in the morning and goes down during the day. Immune system is a big one. And that's why we emphasize for people. If you need to keep up your adrenal immune system, as we know, especially during this time of the pandemic, mood swings. Blood sugar is very dependent also on adrenal function. Many times when we have people that go through hypoglycemia, we tell them we really need to, number one, adrenals first to strengthen the adrenals. Then you will find that your blood sugar will be much more stable. The blood pressure also. One of the signs of people that have very low adrenal function is that they have very low blood pressure. They have problems making adjustment, for example, from lying down and getting up fast because the blood pressure would drop. But they also have low adrenal function. You find that they tend to crave salt. That's one of the questions that we will ask them. Do you crave more salt or more sugar? Because if you crave more salt, it generally means that your adrenals is exhausted. We say low energy, concentration, and also aging much faster. So that's one of the key to maintain the adrenals, the DHEA. Let me see whether I may not have slide on that one. But there are two components, the DHEA and cortisol. Many of you have heard of cortisol, right? Cortisol is basically known as a stress hormone. When you're under a lot of stress, the cortisol level would go up. Cortisol will work against the adrenals. So you want to have more adrenal DHEA and less of the cortisol. Any questions so far? Because I'll be happy, since it's a small group, to answer questions as we go. At the end also, we will have more time for questions.
Dr. Wong?
Yes.
Your
Hi, Mona.
your microphone keeps going in and out. So
Oh, I'm sorry.
those,
Maybe
say something and then it'll fade out. At least on mine.
maybe the connection is not so good. How is that, Brian? Did you have the same problem?
Yeah, the audio seems to be going a little bit in and out, so it might be a connection.
Maybe it's I'm moving too much. I'm not. Yeah. Okay, I'll try better. Maybe not moving as much, because I think when I move, it might also affect that. Yeah. Anybody has any questions regarding
The bioidentical hormones, are they the same as hormones? I mean, because
That's a good point. Thank you for bringing that up. Okay. The reason also why a lot of women did not like the hormone replacement many years ago, before we really got into the bioidentical, is because they were using. Now, many of you have heard of the, oh, come on, what's the horse's urine, Premarin, right?
yeah.
You know what Premarin stands for? Pregnant mare urine,
Right.
Premarin. Okay, that's why many people did not get.
You're cutting out again.
Yeah, mainly because it's not our, it's from horses. That's why bioidentical hormones are much more popular. Bioidentical hormone means that it is very similar to your body system. Remember, with the three different estrogen, we were saying that E1, E2, and E3. With bioidentical hormone, giving you would be mostly the E3. which is the major one in your body system. But we do also give you a little bit of the E2, which is the estradiol, because only with the E3 you may not be able to eliminate all your symptoms. But with a small combination, the most likely combination would be 20% of the E2, which is the stronger estrogen, and then 80% of the E3. We find that that balance usually works for most people. But many times we also like to add a little bit of progesterone body system. Unfortunately, the regular GYN would tell women that if they've had a hysterectomy, hysterectomy, they do not need progesterone. And I tell you, that is a fallacy, because your body still needs progesterone for moods and for bone building density. Yeah, progesterone is important.
I was told by one of these doctors that I had seen that when you're older, you don't need hormones, which is crazy. He said you're too old for hormones.
Well, remember that not everybody needs the same kind of hormone combination and the amount. My approach to hormone replacement is that use the least amount that you need, maintain the balance.
Right.
There's too much, even with the bioidentical hormone, your risk for like breast changes and so on, cancer, is much less, but it is still there. That's why you need to have it monitored on a regular basis, with the GYN, with the testing and so on. Yes.
So they, because they did find a little DCIS years ago in my breast, and they took that out, and I've had all the mammograms and everything since. I told you that. They just absolutely say that I shouldn't have any. They don't know anything about it. I did see one doctor that said that he could do bioidentical hormones, but he said he'd have to have a letter from the surgeon or the person that did that, and they don't have any record of it. It was so long ago.
I see. Because actually, enough, even with the, let's say, women that have had breast cancer, as you know, they determine whether it's estrogen sensitive or progesterone sensitive. If you are both, then you probably have to be careful with hormones. But you still can take some. Perhaps not the so much. I would definitely probably eliminate the estrogen, but maybe possibly a very low dose of progesterone. I think what's more important is the adrenal hormones, DHEA. Because the DHEA, remember, helps to break down to the other hormones.
Mm-hmm.
The other very important one for women that had the breast cancer history, melatonin. Most people know melatonin for sleeping, right?
Yeah.
But there's a doctor in Italy that he has placed a lot of women that had breast cancer on very high doses of melatonin. They find that it really makes a difference in the overall immune system. Yeah. Actually, for the price, that you pay, I would highly recommend, if you're trying to so-called have longevity, to stay young, to have good immune system, I would highly recommend melatonin at nighttime when you sleep, anywhere from 1 to 3 milligrams, and not necessarily taking it every night, maybe like 3 to 5 times a week. And you find that actually that helps the immune system also. The other wonderful thing about melatonin, which I love to dream, and melatonin will definitely enhance the dream, make it very vivid. Yeah. In fact, I've kept dream journals for many, many years, and I love to, just have a good dream.
Well, then you should try some of their CBDs because they give me some of that, and that makes you dream too.
Yes.
But the bioidentical hormones, are they, when they say I shouldn't have any hormones, are they the same thing as taking hormones then?
Well, I think you still have to be careful. But I think identical hormone, you could possibly, depending on the symptoms, what we're trying to accomplish. I think it has to be individual.
Accomplish bone, the osteoporosis. problem.
Taking maybe a very low dose, like I mentioned, of the DHEA. Because interestingly enough, DHEA in women definitely will break down to more testosterone. As you know, testosterone is one of the density. That's why men generally have better bone density than women. Okay.
Yeah, and you gave me some of that, but the doctor that I said, oh, you can't take that. You can't take. Because
Yeah.
I liked it. I felt better. I felt like I was building more muscle, and I felt like, you know, maybe it did help with the memory a little bit too.
Yeah. Yeah, we could work with you. I think pregnenolone might be a good one for you too. It's pregnenolone, you know, like we say, it's better for you to take hormones in the upper part of the chart. If you recall here, I'll show you again. Example, better to take the pregnenolone, DHEA, and allow your own body to break down to the other hormone.
Uh-huh.
Yeah, that's how we would approach it.
Is it safe for me, considering that I have
Again, I
that?
think, you know, we need to individualize. I'll be happy to, you know, like review the past history and then decide what would be safe for you. Yeah.
You know, you're fading out again.
Sorry. Like I mentioned, that we'll be happy to, like, you know, do some testing and then see whether it may be appropriate for you.
Uh-huh.
Any other questions from anybody? I don't know how much time we have. I guess we have about half hour. Do we have 1 hour, Brian?
Yeah, we have an hour, so
Okay.
half hour left. Yep.
Any questions?
Yeah, if you have questions, go ahead and unmute yourself.
Well, I can still ask about, because I signed up for a year with Brian, and he said that if, you know, that if I got a prescription from you, that I could at least, but I think there is a case where you can do it with Medicare and HealthNet, but I don't know about, since you're not a Medicare provider, that would work, but I could use it for at least a write-off or something if I had.
Oh, okay, sure. Well, the good news is that we are hoping to get back on Medicare. We have reapplied, and then we hope to hear from them probably within the next month or so. Yeah. And of
Okay.
course, they will cover density testing, all the different blood testing,
Yeah.
and so on. Yeah.
Is there-
Unfortunately, yeah, go ahead.
Is there at a point at an age where you shouldn't take hormones at all? Like I'm an older female, and I never did take hormones. I was afraid of them, and so being 69, is there an age where you don't, or you still the HEA would provide some help?
You probably, especially if you're not having symptoms, your requirement for hormones will be much decreased.
Mm-hmm.
Now, many of you have heard of Suzanne Summers,
Yeah.
Mm-hmm.
but she's done a lot of work with hormones. In her thinking or estimation, she thinks that women should continue on hormones all life and that they should have periods, which I totally disagree,
Oh.
you know, because in order to have periods, your hormones level has to be quite high, you know. But I think the way she's doing it, a close follow-up with her doctor. And in that way, it's probably okay. But you know, I'm not in agreement with her approach. As I mentioned, I think that you could probably benefit from, depending on your symptoms and you know the levels of testing, you could possibly benefit from some pregnenolone if you're having some moods or memory challenges, and just use some pregnenolone and maybe some DHEA to maintain good immune system, and then let your body do the other work. Your body can break down into the other.
Mm-hmm. Well,
Of course,
thank
we
you.
talk about the whole lifestyle. You know, I think Dr. Nicole talked about the importance of exercise, right?
Mm-hmm.
The importance about you know, mental attitude. Your thinking. I always like to say that, you know, the connection to nature. What I do is my earthing. You know, in the morning, I would go to the park. Fortunately, I have the Veterans Park very close to my house. I would take off my shoes. I would walk barefoot on the park, on the grass, for maybe 20 to 30 minutes. And I find that really helps to calm myself down and get me aligned with the earth energy. They have done very good studies that people that have high blood pressure actually can bring down the blood pressure. Of course, the ground is getting a little bit cold now. It's still very refreshing to be able to do that.
Well, that also resets your internal clock so that you can sleep better at night. You know,
That's true.
you say to be the early, I mean, the first thing in the morning, you should get out and get like 15 to 20 minutes of sunlight, and then it resets your clock.
That's a lot through what we call the pineal gland.
Exactly.
You know, our pineal gland with the light. That's why in many instances, people are having so-called the mood problems in the wintertime.
Right.
Heard about the light boxes, right? People are using to help with their moods. And then that's why people also have, a lot of problems with jet lag. Because you're going through so many different time zones. And one of the cure or helpfulness for the jet lag is when you come back to your location, is to be out in the sunlight, exposing yourself to the sunlight so that the sun can enter and stimulate your pineal. Melatonin is excellent. That's why for all my travel, definitely use melatonin at nighttime. Reset my time clock, like you were saying, Mona, to reset your time zone and time clock.
Can you take too much of that though? Because I take it every night.
Now you can take too much, but you might get a little bit groggy in the morning. So you might just have to adjust the dosage. But actually, interestingly enough, that's one reason why older folks have trouble sleeping at night. Because as we age, melatonin decreases in our body system. Yeah, that's why replacing the melatonin, you can find the best dosage for yourself. You know, if 1 milligram works, it's better than nothing. Generally, I would say 2 to 3 milligrams would be probably the more optimum amount.
Yeah, they do say that 3 is too much, that 1 is better. I have a time-released one that's really good.
Problems absorption, sublingual, put it under your tongue. And you know why it works well with sublingual? Because a lot of blood capillaries under the tongue. It dissolves and gets to your bloodstream right away.
Right away, yeah.
That's another good way to do it.
And Brian's going to start getting some of that sublingual stuff, right?
Sorry?
Yeah, I'm going to be carrying, it's a product line called Quicksilver Scientific, and all their products are sublingual, which is why I really like them. So they do have like the vitamin D and K, they do have NADA, they have melatonin, vitamin C, so everything's sublingual so that it absorbs faster into your bloodstream.
Right.
Yes, yes. Yeah, thanks for bringing that up also about the vitamin D. We did touch upon the vitamin D, you know, but we find that in order to build strong bones, you have to have vitamin D and also the vitamin K. They kind of work together. Most people think of vitamin D, of course, coming from dairy products because they often add extra vitamin D. And interestingly enough, it's a good idea to get your vitamin D level measured. Find so many people lacking in the vitamin D. When you think about it, vitamin D really is a hormone. And in the past, you increase it by sunlight. But the reason why many people don't have improvement of vitamin D is because we have so much smog and pollution. Yeah, so we're not absorbing it. And we're using a lot of sunscreen. And that also decreases the absorption. Vitamin D, if you look at the laboratory value, it says that if you are 30 and above, you're sufficient, but 30 is very low. You should be at least between 60 to 80 to be in the optimum range. So have your doctor check your vitamin D. And if you are low on the D3, generally recommend some supplements. But be sure to take your supplement also with food. Because remember, vitamin D is an oil-soluble vitamin, so you need to have food for absorption. Now, we hear a lot about calcium, calcium for bones. To me, it's overemphasized. Actually, you need more magnesium. You really need the balance of the calcium magnesium. Too much calcium actually is not that good for you. People that eat a lot of high protein diet, getting way too much calcium. In fact, if you have high protein in your diet, the requirement of calcium goes actually up. If you look at the supplement, calcium comes in many different forms. Calcium, very common is a carbonate. They call bone meal or oyster shell. To tell you the truth, don't waste your money on that. Your body can't absorb it and break it down. The best form of calcium is probably the combination. Calcium glycinate is a good one. Calcium citrate is another good one. Most time you need the combination would be the best.
Right.
Yeah. If you notice what you buy in the store, calcium, usually they will combine with magnesium.
Mhm.
Okay. And if you notice that it's 2-to-1 ratio, means it's 2 parts of calcium to 1 part of magnesium. Better dosage would be 1-to-1 ratio. We find that so many people are low in the magnesium. That's why they get muscle cramps. That's why they get digestion problems. The problems with constipation. They can't sleep. So I generally recommend people take some extra magnesium at nighttime, at bedtime. Yeah, because it will help you rest much better. It will also prevent problems of the leg cramps. Plus also actually will help with your bones also, the magnesium.
If you take the magnesium, because I take the calcium, the D3, the K, and all that stuff with a smoothie, usually around noon or 1, but I have the strontium in the morning. But if you
Yeah,
take
strontium is another trace.
you believe in strontium too,
Yeah,
right?
strontium is very good.
So I take that, and they say, you have to do that on an empty stomach. So they say you do it at night, but then I wouldn't want to mix it with the melatonin. So I do it in the morning.
Take it in the morning or the noon time.
Yeah, I do it in the morning and wait at least 2 or 3 hours before I eat anything. But would that magnesium help you to sleep even though you took it at 12 o'clock?
You mean 12 o'clock?
I used
12
to take
a.m.
it at night, and it would I could take it, and 30 minutes later I couldn't keep my eyes open. I'd take five.
It really relaxes you. Yeah.
Hey, Dr.
Actually,
Wong,
talking about the
Mallory.
bedtime, it's a good idea to try to go to bed by 10 to 11. Because interestingly enough, we did talk much about growth hormone. When people are younger, that's the time the growth hormone is being secreted.
At 10 to 11?
About 11. Okay, that's why it's important. With older age group, we don't really manufacture much of the growth hormone. Sometimes people use growth hormone for improving bone density, especially athletes and also the younger group. It's a good supplement, except it's so expensive these days. You have to really get it by injection.
Well,
It used to be like $300 for a whole month of growth hormone. Now the price has gone up to about $800. But we have some people that swear by it, and they use the growth hormone to help to maintain good bone density, helps to maintain good muscle tones. It's a good one to get rid of the abdominal fat and so on. Yes.
Well, I keep getting these things from alpha HGH, which is growth hormone. And
I'll tell you, the ones by oral, even though they say a lot of good things about it, I think studies have shown that's really not.
It doesn't, and I know when I did have that thing, and they didn't give me anti-hormones. They didn't put me on something like that, but they told me I couldn't, that I had to stop the progesterone and the Provera, and that I couldn't take that HGH growth hormone anymore. So would that probably still be the case now too? But
I think they're understanding a lot more about the growth hormone. Obviously, if you take too much, side effects. Because interestingly enough, growth hormones related to diabetes. If you take too much of the growth hormone, you can actually develop maybe diabetes or blood sugar problems. And then also high levels of growth hormone will cause problems with the bone, the joints. because it causes swelling.
Hey, Dr. Wong, I think
Yes.
Valerie, do you have a question?
Yes, I did. It's a little late, I'm sorry, but getting back to vitamin D, I have a high PTH hormone, and I always thought it was innocuous to take high dose vitamin D3 and K2, but the doctor just told me that I should cut back on that because it will pull more calcium out of the bone. Is that true?
Because you have the condition with the pituitary, right? PTA.
Parathyroid.
I'm sorry, parathyroid, yes.
Yeah.
Parathyroid does kind of keep the balance between the calcium and the vitamin D. Yeah. So your parathyroid, have you had it removed? It's overactive, or what is the condition?
I have an adenoma on it.
Oh, I see. Okay, so it's affected.
So I go next week. They'll probably want to remove it, but do you know of any alternatives to not removing it?
Yeah, I would have to think. What you can do is maybe get back to me. I'll be happy to maybe talk more about that. Yeah, the parathyroid obviously does affect the bones, bone density and so on. Yeah.
Well, the vitamin D, everything I've ever, read, it seems like there's no, it's a safe limit to go high dose vitamin D3, D3K2, like 10,000 IU.
Then,
And
okay, but you
this
want
was
to
the
have
first, yeah.
your levels measured though, because if you're too high, for example, if you're hitting like 120,
It was
level,
88. About
88 is actually a good level to keep that.
Yeah.
If
So,
it goes
but
up
yet
to
he
be,
told me to cut down on it. So
you want it to be a little bit lower.
yeah.
Uh,
So I was just surprised to find out that there is a threshold that could be dangerous.
yes.
I always thought it was free license on vitamin D3K2.
No, I
but
think that any supplement, excessive amount does not necessarily mean better. That's why the balance is really the key. Yeah. When you have too high levels of vitamin D3, you can get into bone pain. And then sometimes also you get into headache. Those are some of the side effects of so-called high hypervitamin dose, vitamin D doses. Yeah.
The optimum level 60 to 100
Yeah, 60 to 80 is what we like.
to 80. Oh,
Yeah, 88 is actually a pretty good level. And again, listen to your specialists, because they know your body, how your body is functioning, so they can kind of give some guidance. Yeah.
thank you.
Oh, you're welcome. Let me see here. I would kind of like to just close. Is there any other questions? Okay, I just want to again emphasize the importance of the body, mind, and spirit. I think Dr. Nicole touched upon all these things. I think Brian's probably going to arrange some time for a nutritionist to talk a little bit more about foods that can help your body system, where you actually can get more vitamin or calcium without having to use a lot of dairy products. Because we forget that nuts and seeds, sesame seeds is one very good source, and also the dark green leafy vegetables, broccoli, and all those things has a very good amount of calcium. So nutrition, I think you would. I think stress management. Remember again, we talk about when you have high stress, you create a lot more cortisol. Cortisol is one of the things that will actually break down the bone and cause you to age a lot faster. Fitness programs, do something that you enjoy. Unfortunately, the gyms are closed right now. What I find for myself is, doing a lot of stretching, bands, and so on. And I'm doing a lot of walking, hiking, and so on. It's my fitness. Of course, fortunately for many of you, you can still go into the Brian's place, getting some forms of physical activities to help strengthen your bones. And I like it also because I came in to get a sample session. I like it that they do work on your balance. It's a big key. If you have good balance, you're not going to fall and break your bones, right? In fact, I've been doing some of the exercises at home. Standing on one leg, opening my eyes, I can do it real well. But when I close my eyes, I'm still a little bit unstable. But I'm working on that. Yeah. Of course, we can work on people to so-called cleansing detoxification programs, keeping our body as clean as possible. That's why the diet is important. Try to eat healthy foods, organic foods as much as you can, not a lot of refined carbohydrates. That really works against your immune system and so on. Okay. And then again, like we say, we talk about mind and spirit. All these things are wonderful. Again, with the massages, a lot of places are closed. You know, acupuncture, yoga, martial arts, like we say, the infrared saunas. I think Brian has the infrared, what do you call the plate, right?
Yeah, the red light therapy.
Red light therapy. Yeah, it has the same kind of principle with the infrared saunas. For myself, I have one in the office, fortunately, and I love to sweat. I'll tell you, it's one of the best things for your skin. You know, you come out with your skin glowing. Yeah. And then, of course, with nutrition, we talk about juice fasting, intermittent fasting. I should be adding that to it. Actually, some of these slides, I did a lecture a few years ago, but nowadays it's very popular, intermittent fasting. I think most of us know about that, right? Try to eat within 10 hours. Let your body rest for 12 hours or more, you know? And this really helps you in terms of your metabolism. Actually, it also helps with the hormone. Okay, just show you the, getting, fortunately, I live close by here. So I get a chance to enjoy all the beautiful things in Redondo Beach and so on, yeah. And last of all, just let me share with you, this is our logo for the Health Integration Center. The linking of the body, the mind. We are still working on our website because our old website, unfortunately, was taken over by somebody because we didn't maintain it well, So our new website is healthintegration.center. It's not all done, but you can see what we have on there regarding the therapies that we have, the different practitioners, and so on. And this is my email, the Dr. W at healthintegration.center. Yeah. Like I said, I'll be happy to answer any questions. You can email me or give the office a call. I'm very good about responding, So if I can help you, I can do some research. Come in for a visit because we have so many other things in the office. We have energy healing. We have, like I said, the nutritionist and different things. All right. Let me see. I have probably only a few minutes. Any other questions?
Yeah, if you want to go ahead and unmute yourself and ask Dr. Wong. Don't be shy.
Well, maybe I made it pretty clear.
Mhm.
Valerie?
Thank you. Thank you. I just want to say thank you for your presentation.
Well, thank you. It was my pleasure. Like I said, I'm always happy to share my knowledge. And actually, the other thing I want to talk about is that we tell people that we do not see any patients in our office. We only see health participants. You can see the difference, right?
Sure.
Patient is passive. And patient, the doctor tells you what to do. If you are a health participant, you have to be active, in terms of working together on your nutrition, on your stress management. I think the same thing with Brian's center. You can't improve your bone density if you just come in and just sit there, right? Or just look at the machines, but you actually have to participate. Why I'm trying to change the language that we are using in health. In fact, I have a whole lecture that's called Language of Wellness. Because what we talk about, what we use, really influence our thinking. Just for example, a very simple example is that many times when you ask people, how are you? Most people will say, not bad. Now, why do we use that term? Why can't we say average or doing pretty well rather than saying not bad, right? Because we don't want to really use any negative type of connotation. And another very common one that people use, in fact, I'd like you to start using it. Don't tell somebody, don't forget to do this. Already, if you say don't forget, they already have starting to forget. So a much better term would be, please remember. So please try to make that a regular thing. Please remember to say that rather than say, don't forget.
Yeah, don't ever use the negative before the word. Yeah, that's like can't. The word can't is a killer, I think.
Yes,
If you say
very
I
right.
can't, you probably
Yes.
won't. You won't be
If
able
we
to
can
do
use
whatever.
the right kind of word for ourselves, it will make a very difference in our lives. You know, anything that comes to your brain, thinking and so on. Actually, there's a whole book that's called the Nonviolent Communication. Very good book. It really talks about terminology, the word.
Mhm.
Please remember that.
Yes.
Yes, I think that we're probably going to running out of time. Any last comment, Brian?
Any other questions?
No, I just want to thank you very much for your for all your knowledge and sharing it with us.
Thank you so much.
Yeah, so,
Welcome.
Thank you so much too.
yeah, so definitely, if you have questions later on, contact Dr. Wong. When he first came in and we started talking, I was definitely very impressed by his practice because he's an MD, but he's also looking at it at a holistic level, which is why he brings in additional health practitioners into his office who are nutritionists, energy,
Healing, yeah.
healing. You want all of that because it is a mind, body, spirit. It's not just here, take this pill, or here, take this injection. As he said, you have to be proactive. You have to be proactive in saving yourself, right? You have to do these things. So it's one thing. I always get this. I get this question like, oh, what diet should I have? Well, and my answer is, it's the diet that you stick to.
Yeah.
All it
That's
is.
true.
You just have to have a practice. So what is your daily routine? And they find that people who are high performers have morning routines, right? They really do something in the first thing in the morning when you wake up. So for myself, I have this sort of half-hour ritual where I drink a glass of water to hydrate because you are really dry after sleeping all those hours. I then meditate for about 10 minutes to bring down my cortisol levels.
Mm-hmm.
And then I also then have a practice of gratitude, which Dr. Marcioni talked about last time, where if you are emitting gratitude, then you'll also raise your level and raise your vibration, right?
Yes.
But we're all vibrating, we're all energy, right?
Mm-hmm.
And then at night, things I take, I actually do take a DHEA pill. I do take magnesium at night to help me sleep. Periodically, I'll take melatonin. But very, very important to actually take magnesium. Magnesium is very important for the bones, but also for your mitochondria. Mitochondria needs magnesium. Very, very important. And that also helps you sleep and everything like that. But you have to go through this practice on a regular basis.
So is it true that you should drink maybe even a couple of, like 2 glasses of water first thing in the morning and water before going to sleep too, right?
Probably not so much going to sleep because I have to wake up to go to the bathroom.
You wake up a lot.
Yeah, but definitely in the morning. That's one of the practices I've learned from my father. My father lived to be about 90. First thing in the morning, he drinks 2 tall glasses. Like Brian said, it helps to flush your body system. Really start being more hydrated. Because, we forget that you can't go by your sense of thirst. By the time you're thirsty, that means your body's already dehydrated. And remember, all the nutrients that you take, all the food being digested has to have a good, fluid, hydration to transport it to the cell. Yeah. Why it's so important. To improve digestion, but try not to drink at mealtime though, because that dilute down your gastric. Try to drink in between meals, or give some time in between.
Yeah. Does it matter if it's cold, or they say it's better to be room temperature? Does it matter?
Exactly. Yes. Room temperature is best.
So cold is
the interesting thing is if you want to lose some weight, cold water is better. You know why? Because your body has to kind of up a little bit. So you burn off a little bit more so-called calories. Yeah. But it's not so good for the digestion, the cold water. Yeah.
Okay.
All right. Any other questions before we end the call?
Thank you, everybody.
So
Now some time.
yeah. So next week we have another doctor, Dr. Tamar Gamliel, and she's a chiropractor. And she's going to be talking about the benefits of the chiropractic practice, but also what's interesting about her, she is also a very elite athlete. She's runs a lot, so she's part of these elite running groups. So she'll be talking about running, exercise, and then also the hormone, female hormone. If you exercise too much, right? Or if you don't exercise enough, then what happens? So she'll be talking about that next week. Dr. Wong, I really want to thank you very much for all this information and sharing it with everybody here. I have this recorded and I'll be sharing the video probably tomorrow.
Excellent. Excellent. Thanks again for inviting me, and thank you, everybody.
Thank you.
Okay, good
Thank you.
night.
Bye-bye.
Night.
Bye.
You know what, Dr. Wong?